Welcome, everyone, once again to this very interesting interview session. Um, I am Emily Sika, and I am the FIP ECPG Publications Team Coordinator for the year 2024. And it is my pleasure to introduce a very renowned pharmacist from the country of Malaysia, who is by name Mr. Teoh Yun. He currently is the Assistant Secretary of the Malaysian Pharmacists Society. He's also experienced in working in the health, wellness, and fitness industry. He's also skilled in translation, healthcare, respiratory therapy, clinical research, and pharmacy practice. So, early career pharmacists, please join me in welcoming our very own Mr. Teoh Yun to the platform.
Yeah, you can call me Teoh, Emily. Nice to meet you.
All right, Mr. Teoh. The pleasure is all mine. Could you please share with us a brief history of your career journey thus far?
Yeah, thanks for the very kind introduction and question. I actually started my career way back 14 years ago. I graduated since 2010 as a B.Pharm degree in pharmacy in Malaysia. I studied in one of the National University of Malaysia, a public university, and then I began my career as a provisionally registered pharmacist in our main state hospital in my hometown. Uh, where we have a lot of patients. There are 1,000 beds there. So it's a huge hospital. We have a good range of learning. We're able to experience TDM, TPN, CDR, everything under the sun. So I'm thankful that I'm trained under that environment that established my learnings and practice. And since then, actually embarked on a 6-year journey as an ambulatory care pharmacist in one of the government healthcare clinics in my hometown in Malaysia. So in that setting per se, it was a totally different environment as compared to a hospital where you focus more on acute care. So that 6 years of primary care journey actually shaped my concept and my value proposition towards how important a preventive care would be and how important long-term ambulatory care could be before a patient ended themselves in hospitals. So there was one very great saying from my senior that if you play your role well as an ambulatory care pharmacist, you are significantly contributing to the lower hospital admission rates, which I somehow agree and appreciate that comment coming to me, shaping my motivation to work on how to prevent admissions in hospitals. So as a primary care pharmacist, we talk about medication adherence. We talk about long-term care that we can provide, which hospitals, it'll be too busy for them to go to delve into it that much. So in ambulatory care settings, we have time to actually spend with them. And also we develop some methadone dispensing systems for our drug addict clients who are trying to get back to a normal life. I also engage in the smoking cessation pharmacotherapy as an ambulatory care pharmacist. So it gives me a lot of pleasure actually to work that 6 years as an ambulatory care pharmacist before I actually pursue my master's degree of clinical pharmacy. There was a dream inside me when I was working in the ambulatory care setting that I would like to return to the hospital to become a ward pharmacist. And my dream came true after I finished my master's of clinical pharmacy in my alma mater in Malaysia. And then in 2018, I started to embark in a new journey as a hospital pharmacist. So I've given the opportunity to be an intensive care or critical care pharmacist, whereby we follow closely to cases and we do a lot of case reviews in our intubated patients require critical care. We build up a lot of systems and engagements, and also during that period, there was because of the COVID-19 pandemic is where we actually developed some. We are able to engage to develop some local protocols to be used by our fellow doctors for treating COVID-19 patients. I also had the opportunity to actually step into the areas where we have to change in our suits before we can go in to see our patients while managing COVID-19 cases. So it was a very huge pleasure for me to work with the team throughout the turbulent times as well. I couldn't imagine how it would turn out those years where we had to battle COVID-19, but I'm always fortunate that we survived through that very well, and we are here today. So that was my journey as a hospital pharmacist thus far. I'm also involved as an antimicrobial stewardship pharmacist, whereby we are checking through cases requiring intervention and also monitoring on the use of the broad spectrum antibiotics in our hospital setting. And also, not to be forgotten, I also engage in a few research and innovation projects for pharmacy. And also, I'm taking care of the respiratory care pharmacy in my hospital setting, whereby we see patients in the outpatient settings, advising on the adherence and the use of inhalers. And also, I'm also working every 3 months with our visiting nephrologists to conduct nephrology clinics. So you can see I'm juggling through different portfolios, but here we are as a hospital pharmacist. It's a small hospital, but that's why we need to be engaged into many activities, but it is always a fulfilling journey for me.
Well, thank you for sharing with us that interesting story. I must say that you have a wealth of experiences over the years, and it's something that a lot of us should emulate, because getting experience from one area to another would help to build your skills. It would help to build us skills totally and make it to be a complete pharmacist. So thank you very much for sharing with us that story. Okay, I would also want to find out from you what you think about the roles and responsibilities of clinical pharmacists in Malaysia, especially in comparison with other countries that you're familiar to. And then what would you say are the unique aspects of the Malaysian pharmacy, the hospital pharmacy system in Malaysia? Thank you
Yeah,
very much.
thanks for the question, Emily. It's a very good question, I would say. Um, to be honest, our clinical pharmacy practice in Malaysia doesn't differ that much as compared to US or UK or any other countries, any of the developed countries in our nation. Even though with Singapore, our neighbor, or Thailand, we embark on the same journey as a clinical pharmacist. We do medication reconciliation, we do pharmacotherapy review, because we deeply believe these are the bread and butters that we need to work on to prevent medication error and any suboptimal treatment to our patients. So we are basically the same, because in this internet era, we do emulate each other and we learn from each other's framework as well. So I would say nothing much different. We also engage in cytotoxic drug reconstitution. We are also doing therapeutic drug monitoring, clinical pharmacokinetics. We are doing parenteral nutrition monitoring. Um, I mean, we can say that we are speaking the same language. What if we are speaking the same language as a clinical pharmacist from the other countries as well? Yeah, so there's nothing much different, but in fact, I would say I would rather be grateful that when clinical pharmacist was first introduced to Malaysia about 80s in the 80s, over the past 30 plus years, it has developed leaps and bounds where we have really keep our pace abreast and also ahead, try to be ahead and try to or at least on par with our counterparts in the Southeast Asian region and Asian region as well. So if you want to say something unique or different, there isn't much to offer, but maybe the way that we have been seeing the cases, I mean, or maybe the formats that we do documentation could differ from one another. But however, in those years, we used to be quite manual in our documentations. But now we are also moving into the era where most of the hospitals and institutions have been using computerized entry to do our clocking, and then we're able to see our patients' notes and records in a much smarter way, I would say, to manage the cases. Yeah, but uniqueness wise, there isn't much I would say to differ, because we have been learning from what what the other countries have been putting on. We also have pharmacist-led clinics where in overseas they used to call it as pharmacist-led clinics. So in Malaysian, this setting we call it as a Malaysian Medication Therapy Adherence Clinic. In the recent engagement in FAPA 2024 in Seoul, or maybe in some of the webinars organized by FIP, one of our DM Tech pharmacists, Dr. Naveen, has spoke through the webinar to talk about the DM Tech project, and apparently it received some compliments from our international counterparts saying this is something they're looking forward. So you want to say uniqueness, that would be one of it, because we are quite into the ambulatory clinical pharmacy services, from bedside to clinic. So we see the patients, we even evaluate the patients in terms of their indices, and also in terms of the adherence. Likewise, if there's an inhaler cases, that we talk about their techniques and asthma control test or CAT score before they were seen by the doctors. So we used to crack down the findings. So when it comes to doctor's door, half of the job that the doctor should do has been done by the pharmacist. So they just need to review whatever we have provided them, what our recommendations, and they just endorse a new prescription for the patient. So our doctors actually appreciate very much on this kind of ambulatory clinical care pharmacy services, because it is their job and the collaboration really works very well. So I'm not sure how many countries are also pushing that globally, but I remember in US they call it pharmacist-led clinics. So this is something similar for Malaysia and has been very useful to our patients, I would say. They appreciate it very much in terms of that. So in terms of bedside clinical pharmacy services in Malaysia, we do emphasize, number one is medication reconciliation. So we do have a medication history assessment form where I used to actually clock all the previous medications patient had to take, and we will actually reconcile it with the current treatment regime that doctor offer in the ward, and we have to track it accordingly to see whether from admission to discharge, what have changes the patient will undergo in terms of medication therapy. Those are the things that we follow. Yeah.
Thank you, Mr. Cho, for that. It is great to know that the hospital pharmacy system in Malaysia is rapidly evolving and is ahead of its game in many ways. And I
Yes.
think from what you have said, there is a lot that many countries have to borrow from the Malaysian hospital pharmacy system. So I really appreciate you for sharing with us that.
Yes.
So going forward, I would also like to know what the opportunities for growth in the
Yes.
Malaysian hospital pharmacy system is, and then are there initiatives or programs that you find to be promising and would like to recommend?
I think it's a very fair question and very good question I would ask. I was thinking about in this era of artificial intelligence AI, we have ChatGPT 4.0, who sometimes can even recommend clinical decisions to us as a pharmacist. I've tried that before, and it's quite kind of a bit accurate, I would say, kind of accurate. In this era of AI or Industrial Revolution 4.0, the opportunities of growth as a clinical pharmacy services in Malaysia could be actually the clinical decision support system that could actually be helpful for pharmacists as well. Because I don't really see there's a clinical decision support system that has been implemented much. Because we are moving to digital health era. Imagine that your daily work would have been well supported with some algorithms when you try to get the best out of for your patients. We tend to memorize the regimes or the guidelines that we have. But as we are marching into precision medicine, right, tailored recommendations with a good electronic clinical decision support system will be the way forward. Furthermore, talking about precision medicine or pharmacogenomics, these are the areas that rarely being discovered or rarely being developed. In Malaysia, we have just started the implementation of pharmacogenomics for some of the anti-epileptics because they tend to cause Stephen Johnson syndromes or severe cutaneous surface reaction. So that is where our ministry started or to embark on the project to know more about the HLA genotypes and phenotypes, I would say. But we can actually do more than that. And recently, our country has also been kickstarted with a My Genome project, where we try to collect genomic profiles of at least 10,000 Malaysians to develop the profile of pharmacogenomics in Malaysia, so that we can know that what is the best bullet to use to hit the target well. So I would say that in terms of the development of clinical pharmacy services, I would harp on few things. Sorry. Number one is actually precision medicine. Number two is the use of AI digital health for clinical digital support system, which a pharmacist as a human should actually work on to develop that. It won't replace a human pharmacist, but it actually facilitates our daily work better, and we can learn from it. Number three is the use of pharmacometrics and also pharmacogenomics as precision vaccine profile. Pharmacometrics is also a way where we used to calculate TDM, but we are moving into a precision medicine way of predicting the best regime for narrow therapeutic index drugs. So pharmacometrics or model-informed precision dosing is something that we should develop further and extensively in Malaysia, because you know that in Malaysia we have diverse populations. We have a wide array of different genes, I would say, because we are not only having only one race, that we have Malay, Chinese, Indian, we have Siamese, we have also a lot of hybrid descendants, means that they are made of different, their parents are made of different races. So that carries a very interesting genome profile in Malaysia. So by having a precision informed dosing or precision dosing that can tailor best to that, then we can even detect any responders or non-responders for certain drugs. Because one size may not fit all, and we can see that as the burden of the medication doses or pill burden increases, there could be something that we can do better to reduce that, and pharmacogenomics and precision medicine is the absolute keyword or buzzword that we should actually harp on currently in Malaysia.
Dr. Cho, can you
Yes,
hear me?
I can hear you. I finished.
Mm. Okay, I needed to be sure you were done. All right, thank you for that insightful response there. So moving on, you mentioned earlier that at the beginning of your career, when you were in ambulatory practice, you learned early on that if you perform your roles well as an ambulatory care pharmacist, you could help to reduce the rate of admissions for patients in the hospital. So I would like to find out what you think is the impact of clinical pharmacists on patient outcomes in Malaysia. And then, are there any specific metrics or success stories that you would love to share with us?
Okay, it's about impact on the patient care. The thing is actually, number one is actually very fundamental basics. We do measure about how does our regime or our care work miracles on in the indices of the patient treatment. Likewise, let's say I'm treating a patient with infectious case of that pneumonia and so on. Or maybe any other infections, are we hitting the right target? So is a patient respond clinically well, from being gravely ill to able to respond to call, able to extubate if they're intubated, able to speak, able to tolerate feeding. That is the best gift, I would say, to me. And in fact, looking at them regaining the energy and able to wind down oxygenation is always a telltale signs of how well we have worked for the patient. Of course, actually, we also talk about how good it is actually in terms of patient's understanding towards why he or she needs to receive the treatment. This is a metric of a clinical pharmacist role, that patient able to understand fully why are they given this medication and why it's so important for them to adhere to it. Sometimes we tend to focus quite a lot in terms of clinical bedside management, which is not wrong either. It is very important, but we may tend to forget that how much of a message reach our patients while we're giving them bedside counseling, or maybe giving their care on the bedside, in terms of how do we advise them on their care. So one of the metrics I would say also is really lies on patient's understanding and adherence. If the patient can fully understanding and fully appreciate, acknowledge what you have been told them about how important is the medication is, that you have already worth all the hard work that you need to do in order to communicate with them. Yeah, these are the metrics I always look upon when I'm performing the daily duties as a clinical pharmacist, I would say. most important and another aspect that I will look on the impact is actually zero medication error. So this is actually an inspiration from my direct superior in my current setting, where my direct superior used to told us that what she sets to us for our daily routine job in the ward is to ensure zero medication error. So this is where the pharmacist should be placed, why he or she should be placed in the ward. Because sometimes we are lacking in appreciation in terms of policy makers, policy making, to ensure that every ward has a pharmacist. People don't really see the value. People tends to actually have more value seeing a pharmacist as a dispensing area, doing counseling as ambulatory care, which is not wrong either. But in a critical point of treatment or the acute point of treatment in the wards, having a pharmacist bedside could always be beneficial. It's not about waste of manpower, but they're always beneficial because we are the ones that need to work on checking through medication errors, optimizing medication therapy bedside, giving proper advices because we see them clinically with our own eyes, with our treating prescribers. We follow them together. So the impact of rather than screening solely based on prescription and lab values are totally different. It's totally different because the aura, the interaction, how you see them clinically improve is different. So based on those three metrics, I would say it also aptly tells us how important of is it to have a clinical pharmacist in the ward. I hope I answered your questions as well.
Yes, absolutely you did. But then do you have any particular story from your experience in the ward? Do you have any particular story you'd like to share with us to drive the message home?
I remember a few years back when I treat a case of unstable angina, which turns out actually to be NSTEMI, non-ST elevated myocardial infarction. Um, I did have time to actually sit down with the patient, go through the medications with them. And there was one incident that I also chip in the counseling on smoking cessation. Could you imagine as a pharmacist, we're not only looking at drugs, but apart from talking about why the drugs is important, I shared with them how important for them and their family members to also stop smoking. Because I told them, no matter how great the drug it is with you, if you don't stop smoking, the detrimental effects will persist on you, including stroke, hemorrhagic stroke, and any other myocardial infarction attacks that will come to you. At that point of time, I do not realize how much impact I've made to the family members as well as the patient until the son actually who joined the counseling session actually appreciate me very much and he say thanks to me a lot of times when we met him and he say even he himself has stopped smoking since then because he doesn't want the father to suffer again. So both father and sons stop smoking together. That makes a lot of fun. I mean, a lot of pleasure to me because I think it worth my hours or my duration spending with them or talking about counseling of drugs and also on smoking cessation. It really made my day. Yeah, and also every time when I see some of the patients, like one of the patients I remember is about inhaler issues, who frequently having inhaler issues. So I had to keep on telling them what to do and also advise them to purchase an aero chamber. It took me some time to show videos, to show them how to use the inhaler accurately, despite a few attempts, but we didn't give up on them. In fact, we tried to think of certain ways to help them and to understand it better, talk to them, having a few more attempts, and there you go, you can see the patient able to use it very accurately, and you can see how much of their asthma control has improved in my clinics as a respiratory pharmacist. So that really made my day, I would say.
Yeah, I can imagine how fulfilling that must have been.
Yes.
Thank you very much for your time today, Mr. Teoh. It was very, very wonderful and insightful listening to you. But just before you go, do you have any parting words for early career pharmacists around the world that are watching you right now? Is there anything you have to say to them?
Yeah. My first call is to become a loyal FIP member. I've been a FIP member for 2 years and I'll be continuously supporting FIP because this is the platform. It crosses boundaries of geographical boundaries. So as I can meet you, Emily, here because of FIP as well, I believe. Uh, supporting FIP as a medium for all the early career pharmacists to grow together with your senior counterparts like me. And then always to support, always be brave enough to ask, to explore is what a early career pharmacist should do. You should not set limits to you. The sky is your limit. You always reach out to people asking and use the platform, the networking opportunities in FIP and your national organization to work and to voice out advocacies. Never stop on advocating the best practice for your pharmacists. Closing the gaps, harmonize the practice is always what we need to do long term as a practicing pharmacist. Do not regress on that. Always think of how we should improve the system. How do we close the gaps and go beyond the challenge in terms of policy? Be brave enough to break the cycle in your practice. This is what we need to evolve so that we can bring our career to a better level. We have seen pharmacists being acknowledged very well by the doctor's counterparts, but also be instances where pharmacists are being oppressed in their practice. Not to mention also not being able to get dispensing separation for some of the countries. But that doesn't mean the end of the world. We can still always advocate the best for our profession, starting from ourselves, starting from our country, starting from the workplace that we are standing and we are enjoying here. Thank you very much.
Thank you so much. Thank you so much, Mr. Teoh, for those wise words. So there you have it. You've heard it from Mr. Teoh. He said, be brave enough to break the cycle in your practice. So that's the goal of FIP, to advance the profession. So hand in hand together, we will do this with time and with the necessary practice put in place. So thank you so much for listening today to us, and thank you so much, Mr. Teoh, once again. Have a nice day.
Thanks, Emily. I hope that my points are beneficial, and if they cross our paths again, then we can have another session with you guys with more sharings ahead. Thank you.